Hi, Nurse Gigi here, and today I'd like to talk to you about administering your own subcutaneous injection. And the reason for that is we have many patients on our weight loss program, and that involves self-injecting once a week the semaglutide, better known as Wegovy or Ozempic. I usually talk patients through it. It's super simple, but I figured it would be best to just show you. That way it takes all the guesswork out of it. So I'll start by going over some of the sites for subcutaneous injection. So subcutaneous just basically means into the fat tissue. So wherever you can get a good pinch of fat, that's where you're gonna inject. Usually it's in the stomach, right? When we self-administer, we can do each quadrant of the stomach, just pinch. Also we can do the thighs, and when I do administer for patients, I do the back of the arms, like the bat wings. But most patients can't reach, so if you have someone to do it for you, that's a good place as well. And I find it's less tender. I'll start by also showing you how small the needle is. There's a lot of anxiety about injections, much less to self-administer. But it is super simple, not just coming from me because I'm a nurse. Once you get over that initial fear, I'll show you just how little the needle is. See? And it's that little because it was designed just to go right under the skin into that fat tissue. So you never recap, but I did, and we do it a certain way. But we always start by cleaning our hands, right? So I have my hand sanitizer, and I'm gonna clean, right? And then I'm gonna select my site. So for me personally, I like to go in my flank area right here. For me, it's less tender, and I can get a good pinch of fat. So what I'm gonna do, I'm gonna go right here, and we're gonna pinch. We're gonna move anything out of our way. We're gonna pinch. We're always gonna clean without alcohol, sanitize, and we're gonna let that dry for a few seconds, mainly because we don't wanna inject while the alcohol is still wet because we'll push the alcohol in and it can burn. After that, we're gonna uncap our needle, making sure not to touch the tip, right? The tip is always sterile. And then we're simply just gonna go right into, the harder you pinch, the less you feel it usually. And we're gonna go right into that subcutaneous space, as you can see, and just push the plunger in. And then that's it. We're all done. And then you can wipe if you have, but most times you won't have anything. And then we never recap the needle. I'm gonna put it right into my sharps container. If you don't have a sharps container at home, you can use like a glass bottle, anything that won't pierce. Just store it in there and cap it and discard. And that's it. That's how you self-administer a subcutaneous injection.